Hello, I'm Dr. Larry Hanus. I'm a general dentist in Iowa City, Iowa. In our practice, we emphasize holistic, biological, and alternative dentistry. What that means is we consider the relationship between your oral health and your overall health in general. This PowerPoint video is on dental mercury amalgam fillings. These fillings have been used for many years in dentistry, but currently there's an increasing controversy surrounding them. You'll be now watching one of two PowerPoints. One is an introductory version and one a comprehensive version on this subject. If it piques your interest, please feel free to view our website, iowamercuryfreedentistry.com. That's iowamercuryfreedentistry.com. Thank you. This is Dr. Larry Hanus, and I'd like to welcome you to our introductory PowerPoint on dental mercury amalgam fillings. These fillings, which release mercury over time, have been used in dentistry for many years. Currently, there is an increasing controversy over their use. What is dental mercury amalgam? The FDA says that these fillings are made of a mixture of metals consisting of liquid mercury and a powdered alloy of silver, tin, and copper, with approximately 50% by weight being mercury. These are also known as silver fillings because of their silver appearance. Is mercury dental amalgam safe? Well, maybe or maybe not, depending on who you talk to. The FDA says this mercury fillings are safe because they've been used for 150 years. The World Health Organization says maybe not, and they urge a switch away from dental amalgam, stating that the amalgam fillings continuously release a significant amount of mercury, which raises general health concerns. What about the ADA? In a 1992 lawsuit, plaintiff Tolhurst filed suit against the ADA and others, alleging that the mercury amalgam fillings were responsible for illnesses he had. He alleged that they had responsibility because they promoted the use of dental mercury amalgam fillings. In a motion to be dismissed from the lawsuit, the ADA stated that it owes no legal duty to protect the public from allegedly dangerous products. The court agreed and dismissed the ADA. Remember, the ADA is not a government organization or a public health organization. It's a private trade organization whose interest is protecting its members. The ADA says the small amount of mercury released from amalgam restorations, especially during placement and removal, has not been shown to cause any adverse health effects. While others say differently. In fact, they say amalgam contributes substantially to the human mercury load, and that the data suggests amalgam is an unsuitable material for medical, occupation, and ecological reasons. Do mercury fillings affect the dentist? Well, research states that dentists demonstrated significantly more prescription utilization of specific illness medications than did controls. This places them at greater risk than the general population for those disorders, as well as threatening the future of America's children and adults. Are there benefits to amalgam removal? The Journal of Dental Research states that after removal of dental amalgam mercury fillings, there was decline in the mercury levels of blood, plasma, and urine. And they also say that after removal of amalgams, 9 of 10 subjects in the study exhibited a statistically significant decrease in blood mercury. Does amalgam fillings crack teeth? Well, amalgams expand when you eat hot food while the tooth does not. It's like running hot water in a jar lid to loosen it, but here the lid is inside the jar, cracking it. So the filling is like a lid inside a jar where the hot water expands, cracking your tooth. Below in the two pictures you can see multiple cracks resulting in fracture. On the left you see two fillings in the tooth with cracks between them. On the right you see the same tooth with a corner broken off and the gums injured as well as the tooth injured. In the photos on the right and the upper, you see arrows pointing to cracks in the tooth from the amalgam filling. In the picture below, you see the amalgam fillings have been removed, the same teeth, and you see the cracks actually penetrate the floor of the tooth, structurally weakening the entire tooth, putting it at risk. What about strength? Dr. Harold Lowe, former director of research at the National Institute of Dental Research, said the first filling is a critical step in the life of your tooth. Amalgam requires removing a lot of the tooth, disease as well as healthy. He said you sacrifice a lot of the tooth breaks off, you need a crown, and you see, in fact, this is what's happened in the tooth on the right. He goes on to say that new materials, composites, bond to the tooth and actually can strengthen the tooth with little removal of the tooth. In the pictures below, you see on the left 2 amalgam fillings. On the right, you see the fillings have been removed and replaced with composite. Are composites really stronger? Well, 2 prestigious journals state that there is no difference between the rate of replacement for amalgam and composites, and that the choice of material used was not associated with the longevity of the restoration. The International Academy of Oral Medicine and Toxicology, an organization of doctors, dentists, and research who oppose the use of dental mercury amalgam, states, the risk of illness or injury associated with the use of dental mercury presents an unreasonable, direct, and substantial danger to the health of dental patients and the health of the dental personnel, and they recommend removal of existing fillings. Thank you very much for reviewing our PowerPoint. You may find more information on this subject and others at iowamercuryfreedentistry.com. That's iowamercuryfreedentistry.com, or you may call our office number 319-512-5655. That's 319-512-5655 for additional information or to schedule an appointment. Thank you.